Brittany Murphy. I'm a nurse practitioner student, and today we're going to be doing a physical head to toe assessment on you, okay?
Okay.
I'm going to wash my hands, provide my privacy, gather my supplies, and don my gloves. Can you state your name and date of birth for me?
Lady Shelton, October 1919.
Okay, and do you know what we're doing today?
It's a head to toe assessment.
Okay, do you know what city we're in?
Columbus,
State?
Mississippi.
Who's the president of the United States?
Nobody.
Okay, so the patient is alert and oriented times 4. So first, we're going to get the patient's vital signs, height, weight, blood pressure, temp, pulse, respiration, oxygen level, and ensure that the patient is not in any pain or distress. So we gather all of our vital signs, including height and weight. Okay, next we're just going to inspect the face and make sure we don't see any lesions, bumps or bruises, any asymmetry or anything like that, and we don't. The skin is great and symmetric. Now we're going to inspect your hair and look at your hair and your scalp and skull. So we're going to part the hair and make sure that there is no lice or nicks or lumps or anything like that. We're going to palpate the skull and make sure that the skull is symmetric and contour. Okay, no discoloration to the face, no lesions or facial hair noted. So now, can you bite down for me? Okay, puff out your cheeks, smile, frown, wrinkle up your forehead, stick your tongue out, and wiggle it from side to side. Okay, thank you. Next, we're gonna get our cotton ball, and we're just gonna check and see if you have any sensitivity to light touch, okay? So the forehead, the cheeks, and the chin, and we'll do that on both sides. All right. Now, next we're going to palpate your temporal arteries, and then we're going to palpate your frontal sinuses, and then the maxillary. Do you have any pain or tenderness?
No.
Okay. Now we're going to look at your eyes. So first we're going to just look at them and make sure you don't have any drainage or discharge or discoloration. And we're going to do this to both eyes, not just one. So we're going to pull down and shine the light in and look. And the sclera is white, the conjunctiva is nice and pink. Can you look up for me? Look up, look down, and look into the light. Thank you. All right. Next, I want you to keep your eyes on this for me. I'm going to bring it to your nose, but don't move your head. Okay, good. And I want you to kind of stare off at something at that wall, and I'm going to shine this light in your eye, okay? And we're going to do this on both sides. Okay. Now I want you to follow this, but don't move your head, okay? Thank you. You did so good. All right, so the next thing you want to do, I want you to cover your left eye. Okay, and I want you to tell me how many fingers I'm holding up.
2.
Okay. Cover your right eye. And we're going to do the same thing again.
1.
Okay, good job. And next we're going to look at our chart up here. So I need you to stand and stand back here. And the patient will be standing at 20 feet. And I want you to read the smallest line you can for me.
E, D, F, C, V, P.
Okay, cover your right eye and repeat.
E, D, F, Z.
Okay, and cover your left eye and do it again for me.
E, D, F, Z, P.
Okay, that's it. And you can have a seat. Okay, next we're going to inspect the ears. So we're going to just check the ears and make sure you don't have any lumps or lesions or anything. We're going to also palpate the ears and make sure that no lumps, bruises. Do you have any pain or tenderness to touch?
No.
No swelling or drainage noted. So now we're going to look in the ears and look at the tympanic membrane, which is pearly gray and shiny. We don't see any redness or anything like that. No drainage. And both ears are symmetric and aligned. Okay. We did the smell chart, we did the ears. Oh, we gotta palpate your lymph nodes, so we're gonna palpate here. And let me know if you have any pain, okay? Okay, behind the ears, down the neck. No tenderness or edema or nodules or anything like that. And I'm gonna cover your ear. And I want you to tell me what I'm gonna whisper to you, okay?
Healthy.
Okay, and we would do that on both sides. Alright, now we're gonna do our tuning fork test. So we will strike it, and I'm gonna put it on top of the patient's head, and the patient will let me know when she does not hear any sound.
No sound.
Okay, we'll do it again. We'll put it behind the patient's ear and then bring it out, and she will let me know when she doesn't hear any sound.
No sound.
Okay, and we will also do that on both sides. Okay. Next we're gonna look at the patient's nose. We're just gonna make sure that the nose is midline and symmetric. We're gonna look inside the patient's nose and make sure she don't have any swelling, drainage, or nodules. Can you cover one of your nostrils for me and sniff? Okay. And we will do that on both sides to make sure that the patient doesn't have any kind of congestion, no discharge. And we're gonna get the patient to smell, and just tell me what you smell.
Vanilla.
Okay. So the smell is intact. Next, we're going to inspect the patient's mouth, and we're going to be looking at the hard palate, the soft palate, the tongue, making sure the patient don't have any lesions or sores inside of the mouth. And when I'm gonna put this in your mouth, say ah. Okay, the uvula is midline, the tonsils are about a 0. No swelling or discharge or anything noted from what we can see upon examination. Now we're gonna look at the front of the neck. Okay, and can you hold your head back? Can you swallow for me? Okay, and now they're just checking the thyroid to make sure that she doesn't have any problems with her thyroid. We're gonna palpate the thyroid. No pain or anything like that. So now we're gonna check your carotid artery and listen to it. Just make sure that you don't have any bruise. Okay, we're gonna do it with the bell of our stethoscope. So turn your head the opposite direction and take a deep breath for me. Okay, all right, the other side. Okay. And now we're gonna palpate the cervical lymph nodes just to make sure she don't have any type of swelling, and it's non-tender, it's consistent, even mobility. We're gonna palpate the trachea and it's midline with no deviations or anything noted. So with your head, we wanna check and make sure that you have adequate range of motion. Can you lean forward, chin to chest, lean your head back, go around in a circle, left to right. Okay. And I'm gonna put my hand on your shoulders, and I want you to raise your shoulders up for me. Kind of shrug your shoulders. Okay, good. Now we're gonna look at your chest and lungs. We're gonna inspect. So I want you to just take some regular breaths for me. Okay. And we're looking at anterior, posterior, as well as lateral, to make sure that the patient doesn't have any inconsistencies, and make sure that the breathing and expansion is symmetric. So the shoulders and muscles are symmetric as the patient is breathing. No type of bare chest or respiratory distress noted. Can you turn around for me and turn your back to me? As I put my hand down, I want you to say 99 for me, okay?
99.
And we're just palpating for tactical premises. And while we're back here, we're gonna go ahead and look at the vertebrae and make sure that it's aligned, and it is aligned with no tenderness or anything noted. Now we're going to percuss, so turn around to the front for me, and we're just gonna percuss your lungs. And if you feel any pain or discomfort, let me know, okay? All right, your arm out, go to the side. Okay, turn around, gonna do your back. So no pain or discomfort with me percussing?
No.
Okay, so now we're gonna listen to your breath sounds. We're gonna do the front first. And I just want you to take some normal, even breaths for me, okay?
Okay.
In. Okay. Okay, and turn around, we're gonna do your back. Deep breath in and out. And can you say E for me?
E.
Once more.
E.
Okay. E.
E.
And we're doing this to make sure that we don't have any ego phony, which we don't. Okay, next we're gonna do your heart. So we're gonna just look at the chest and make sure that everything looks good. Of course, the skin on the chest looks good. No lesions or discoloration or anything noted. We're going to look for JVP and as well as check your carotid. So turn your neck. We checking for any pulsations this side. Okay, and that is good. Now we're going to. I'm going to have you to lay flat. You lay down with your head this way so the camera can see us. Okay, so first what we're going to do is palpate the precordium. And if you feel any pain or anything, just let me know, okay? Okay, now we're going to percuss all areas of the heart. And if you have any pain, just let me know. We're supposed to have percussed and palpate. We did it out of order, but we got it done. Next, we're going to listen to the heart. We're going to listen with the diaphragm and the bell. We're going to do the diaphragm first. Okay. 1, 2. Down here, do the apex. Then we're going to flip over. Come down here and do the apex. Right. And with the bell of the stethoscope, we can determine if we hear any murmurs or anything like that, in which we did have normal S1 and S2, and no more murmurs or arrhythmias were noted. And like I said, we would have percussed the borders of the heart. We can do that again, but we already done it. I did it out of order, sorry. So we'll percuss the borders of the heart. Alright, next, what we're gonna do is I'm gonna have you to sit up and we're gonna palpate the PMI, which is here, and let me know if you have any pain or discomfort. Any pain or discomfort? No. Okay. Alright, next we're gonna look at your arms. So just hold your arms out for me. The arms are symmetric. No lumps or lesions or anything noted. No changes in skin texture or discoloration or anything noted. We're gonna also look at the hands. Hold your hands out for me. Hands they look pretty good. We're gonna check. Our cap refill is less than 2. We're gonna, no clubbing is noted. The skin is normal. We're gonna palpate and just make sure that the patient has adequate and good skin turgor, and she does. Now we're going to palpate your arteries here, and then brachial. Okay. Oh, I think we forgot to palpate the carotid arteries. I think I forgot to do that, but you would do it when you are assessing the neck, and you would do it, you would separate, you wouldn't do them both at the same time, so, sorry about that. Where was I? Okay, we was doing the extremities. We was doing the arms. Oh, so with your arms, I want you to bring them up and flex, okay, extend, bring them out, and then down. Put your hands down like that, bring them up like that, okay. Do your fingers like that, and hold your hands out for me. And we're gonna just check and make sure that the patient doesn't have any carpal tunnel. Bring your hands back to back like that, okay. All right, now we're gonna get you to lay down and we're gonna look at your abdomen. So in assessing the abdomen, we want to make sure that the abdomen doesn't have any hernias or pulsations noted, that it's even and symmetric. That we don't see any nodules or lumps or anything like that. No symmetric, make sure that the abdomen is symmetric. The skin is good. No discolorations or lesions noted to the abdomen. And next we're going to auscultate because it is the stomach. So first we're going to do the quadrants of the bowels, and you will listen to the minimum of 5 minutes in each quadrant. 3, 4. Okay. And then next we're going to listen to for any venous. We're going to listen to the venous arteries, vascular sounds, the aortic, the renal, the iliac, as well as the femoral, and you would do this with the bell of your stethoscope. So, yeah. Deep breath in and out for me. Next, we're going to listen to the liver and spleen for any venous humps or friction rubs. So, this is the liver on this side. Place my hand over here. Okay, and then we're going to go on this side as well. Okay. Next, we're going to measure the liver as it expands. We're going to have the patient to take a deep breath. I'm going to place my hand under here, and we're going to do right mid-clavicular, and there is no enlarged liver noted, and then no splenomegaly noted on this side. Next, we're going to palpate. We're going to do light palpation, then deep palpation. And while I'm palpating, I want you to let me know if you feel any pain, okay? So this is light. Okay. And we're just palpating here. And then we're going to go deeper. And just let me know. Okay. And deep palpation. Okay, and take a deep breath for me. Palpate for a little clean. And then on this side. Okay. Alright. And the kidneys. Deep breath. Okay. Deep breath. Alright. Next we're going to check for a Murphy sign, and it's just going to make sure you don't have any cholecystitis. So, deep breath for me. Okay. Breathe out. And next we're going to check and make Bernie's point. You okay?
Yeah.
Alright. So you can sit up. Oh, wait, we haven't percussed. I'm sorry. We gotta percuss. We're gonna percuss over the bowels. Okay?
Yes.
We're gonna percuss all 4 quads, all 9 areas. Okay, now we can sit up. And turn your back facing me. And we're gonna check for any costovertebral angle tenderness. So just let me know if you feel any pain, okay?
Okay.
Any pain?
No.
Okay. Now we're gonna look at your legs so you can sit straight for me. And both legs are symmetric, they're even, normal in size, no arterial insufficiency noted, no skin changes noted, skin turf appears to be good. I'm going to check for any edema, no edema, normal skin temperature, no swelling. I'm gonna palpate the pedal pulses, tibial, popliteal, and then we will also go up there and do the femoral as well. Now, can I get you to lay down? We're gonna do range of motion of your legs. So now I'm gonna first do the hip. So I'm gonna bring the leg up. Any pain?
No.
To the side, out,
No.
in. Okay, we're gonna do your knee. Any pain?
No.
And the feet, up, down, in, out. Okay, so now what I want to do is test your strength. So I'm gonna push on your leg, but I want you to push back on me, okay? So push back on me. Okay, good. Push up, push leg out against resistance. Okay. Push your feet down. Push your feet up. And I will have her to flip over, and I would have her to push against my hand with her leg as well. All right, you can sit up. Well, stand up for me. Close your eyes, and I want you to kind of sense if my finger is up or down.
Oh.
Okay, so we're checking neuros right now. Next, I want you to touch your nose, open your eyes, touch your nose, then touch my finger. Do it again, nose, finger, nose, finger, nose, and finger, okay? Next, I want you to run your back of your feet down your leg, the shin of your leg, the front of your leg, other side, okay? And I'm going to be checking your spine as well. We're going to check the spine, the thoracic, cervical, and lumbar spine to make sure she don't have any pain or tenderness, and make sure that it is aligned, and it is. Bend your knees kind of like you're going to squat a little bit, okay? Up, bend over, touch your toes, up, put your hands on your hip and side to side, back, forward, okay, good. And next I want you to walk to that door, okay? And when you come up, turn around, walk on your heels to me. Now your tiptoes. All right. Place your feet together, close your eyes, just checking and making sure that the patient doesn't have any swaying. Do you have any dizziness?
No.
Okay. All right. And that completes our head to toe assessment. Thank you.